Hello, everyone, and welcome to the Peers Introductory Presentation. My name is Alyssa Archer-Cooper, and I'm going to discuss the program in depth and its delivery at the Wellness Center. So, Peers, which stands for the Program for the Education and Enrichment of Relational Skills, is delivered right here at the Wellness Center, a licensed health facility established in 2004 where a comprehensive psychological, mental health, behavioral interventions, and corporate wellness services are offered to individuals and families and organizations here in the Cayman Islands. So, what are we going to be looking at? So, we are going to focus on the following. What are social skills? The importance of social skills. What is peers? What is the evidence for the efficacy of peers? Who is it for? And how exactly is it delivered? So, social skills, what are they? They are the ways in which we interact with others and the way in which we connect with one another and the qualities of those interactions. So, for example, how exactly are we showing that we are listening to someone? What does our body language look like? Are we giving that person eye contact? Are we listening? Are we sharing? Do we have good teamwork, good manners? Are we patient with the person? Being able to connect with them, being a friend. These are all social skills that we are using on a daily basis. So, why are these social skills so important? So, social skills are important for effective communication. So, how we relate to others, how we connect with others. So, talking about our feelings, sharing experiences, sharing ideas and thoughts, connecting with others really allows us to grow our social network and it allows us to have a greater support system. And this is what generally leads to an increase in happiness, quality of life, and even with regards to career opportunities. Some examples can include how do you interact with clients, social skills that can directly impact your ability to be hired and to keep a job. So, overall, social skills are a large predictor of success, and having good social skills will help you be able to communicate your needs and advocate for yourself. So, now let's get into the nitty gritty. What is PEERS? So, PEERS is an evidence based social skills program that is developed for children, adolescents, and young adults. PEERS was created based on socially successful children. So, asking socially successful kids that are well liked and are able to maintain friendships, what works for you? So, this is what ecologically valid means. It means that you can apply something that works in real life. So, for example, let's say you have a socially anxious child who's attending a party, maybe for the first time, or maybe attending a new school. And you may say, okay, well, just go over to that group of people and just say hi, just introduce yourself. But it's about understanding that we may not necessarily be setting our kids up for success by actually doing that because so much happens before we actually get to a point where we can say hi, such as assessing interest, looking out for their body language, looking out for that eye contact, understanding what it means to be invited into a conversation. Those and so much more are the steps before you can actually say hi and join that conversation. So in peers, we're really looking for those types of practical solutions. So Peers was developed in 2005 at the University of California in Los Angeles by Dr. Elizabeth Logison and Dr. Fred Frankel. So both have worked primarily with individuals with autism spectrum disorder and attention deficit hyperactivity disorder. But they've also worked with individuals with anxiety and depression and just people in general who are struggling socially. Peers is also cross culturally adapted is in about 80 countries and counting, and it's been translated into several languages, which is amazing. So as you can see, there are different manuals for the different versions of Peers, some of which include the Peers for Young Adults, Peers for Adolescents, as well as a school-based curriculum that is centered on lesson plans, which can be done on a weekly basis. So they're also currently working on a preschool version, which is very exciting, and we'll be sure to keep you updated when that comes out. So let's look at some examples now, or just one example in particular that highlights both the short-term and the long-term effects of the PEERS program. So Mandelberg and colleagues did a pre-test before adolescent ASDs, the autism spectrum disorder participants, enrolled in the PEERS program. And then that was followed by a post-test once the program was completed. And then they did a 1 to 5 year follow-up with those same participants. And so when we look at this graph, what we see is the blue here that represents the pretest. The red is immediately following the program, so that's immediately after the program is done. And then the green is the 1 to 5 year follow-up. So in these areas that make up the social responsiveness scale, we have the subscales, and that includes social awareness, social cognition, social communication, social motivation, and autistic mannerisms. And so as you can see, we're seeing a pattern where the T-scores are just getting closer and closer to the normal range as the time goes by. So this highlights this graph highlights the progression of the adolescent social skills knowledge over time. So that's the test of adolescent social skills knowledge, or the task. So the task is a self-report criterion referenced measure that assesses adolescents' knowledge about the social skills that are taught throughout the program, the PEERS program. So we can see that T1 represents the pretest, T2 represents the post-test, so immediately after the program is completed, and then T3, we see the 5-year follow-up study. So we can see a significant jump after the PEERS program was completed, and even though there is a little bit of a reduction at the 5-year follow-up mark, there was still a significant number of skills that we can see that were maintained over time, which is amazing. So who can benefit from PEERS? So PEERS can basically benefit anyone with social challenges. The research supports the use of PEERS as part of a comprehensive support plan for individuals specifically with autism spectrum disorder, ADHD, communication disorder, anxiety disorder, and depression. So other key factors to keep in mind as well when considering PEERS is the social motivation. So the social motivation really comes from the client themselves. We really want those that participate in PEERS to want to participate in PEERS, to want to make that change. And the other aspect of it is the social coaching involvement, which is crucial. Okay, so in total, there are 3 main components to the PEERS program, and that looks at the client sessions. The second is the parent and social coaching session, so parent or social coach. A parent is an example of a social coach, but it doesn't only have to be a parent. And what that means is that it can be a parent, it can be a caregiver, it can be a behavioral coach. So that's what we mean when we talk about that. And the involvement of those social coaches is important because it's basically crucial to the success of the program. And this is what the research suggests. Social coaches are responsible for helping the clients to generalize the skills that are learned in the sessions so that there are constant opportunities to reinforce those behaviors. Child sessions really involve teaching the skill, role playing, and perspective taking to understand why the skills are important. And then tasks of the week are meant to practice those skills at home, at school, and within the community. So, some of the examples of the lessons that we teach include trading information, so use of good conversation skills, which can include assessing interest prior to joining a conversation, and then we really look into the appropriate use of electronic communication, the appropriate use of humor, handling disagreements. Other topics include learning how to handle bullying and changing reputations. And one other important thing to note is that for the young adults group, that also covers dating etiquette. So, proper etiquette around dating and safe practices around dating in general. So, why is Peers so successful? Well, right now, it's the only evidence based social skills program. Um, we have social skills, social coaching training, which is also a part of it. It teaches these ecologically valid skills. So it's so important to teach skills in the ways that their peers are constantly or currently using them. It's also cross culturally adapted, which was mentioned earlier, which is key to being confident to bring this to the Cayman Islands and serving our community here. And so that there's also the role playing and modeling aspect of it, which gives participants the opportunity to really practice the skills in a safe environment before going out in the world and practicing this in a natural environment. And then we have the social coaching along with the tasks of the week, which ensures that these skills are generalized in natural environments. Okay, so Dr. Lageson makes it very clear that to have this progression towards friendship, we need this formula, which is the skills, and we need access to peers, we need coaching, and that's what gives you the progress. That's what equates to the progression of friendship. So looking at the peers delivery at the Wellness Center, we are looking at groups. So in terms of groups, we can offer it as early and pre-adolescent groups, to adolescent groups, to young adults groups. We can also offer it as a one-to-one direct service to really hone in on those skills that are necessary. And then we can also offer boot camps as refreshers to target those key areas in a shorter time frame. And then there's some flexibility for telehealth options, for example, in the case of a pandemic. So, if you are interested in learning more about the Peers program or wish to register, please feel free to pause this video and scan this QR code. Thank you so much for watching.